There's new evidence tonight that a more contagious mutation of COVID-19 is spreading locally in Massachusetts. And here to answer your questions is Dr. Brian Hollenbeck, Chief of Infectious Diseases at New England Baptist Hospital. Good to see you.
Good to see you too.
So the State Public Health Lab has now identified 29 cases of this UK variant. Only 4 of them have been linked to people who had traveled. Why is that important, and what does it tell you about the risk of more transmission here?
Well, that report shows that it is circulating within Massachusetts, which I think we really knew would happen at some point. It was a matter of when, not if. But now it looks like, based on this report, that there is at least some element of this UK virus that's circulating within Massachusetts. So that is important because we know it's more contagious. So there is a risk that cases would start to creep back up again with this circulating if it gains a foothold.
We've talked about this UK variant, the South African, variants from other countries. Are there any variants from the U.S. that you're concerned about, that you've heard about?
There are always different variations of this virus, and there have been since it kind of first was, around a year ago. These little mutations mostly don't affect much with how the virus behaves in terms of how people respond to it or hospitalizations, things like that. The 2 big ones that we're most worried about are the South Africa variant and then the UK variant, both of which seem to be far more contagious and potentially more aggressive.
So let's shift gears and talk about vaccines for a moment here. The FDA meets next week to decide whether to authorize Johnson & Johnson's. That's a single-dose vaccine for emergency use. If they do that, if it's approved, how quickly could that improve the rollout here in Massachusetts?
It would help a lot. I think right now we have people to give vaccine. We have places for people to go for vaccine, but we just don't have enough vaccines to give. And if we could get another company's vaccines coming through, Johnson & Johnson would be a real big boost to moving into the next phases, I would say, in Massachusetts.
All right, so we'll wait to see what happens with that advisory committee next week. Dr. Hollenbeck, thank you for your time. We appreciate it.
Thank you.